A lot of medicines come in a metered dose inhaler, also called an MDI. Use these medications with a valved holding chamber called a spacer. If your child is very young or has trouble with the spacer, you can use a spacer with a mask. In order to get the medicine into the lungs, children under the age of 7 usually need to use a mask. Older children will learn to use a mouthpiece. Remove caps from the spacer and metered dose inhaler. Shake the MDI for 3 to 5 seconds before using. Spray the MDI no more than 4 times before using it for the first time if you haven't used it in a while or if you dropped it. This is called priming the MDI. This does not count as a dose of medication. Insert the opening of the MDI into the rubber-sealed end of the spacer. The mask should be attached to the other side of the spacer. Stand or sit up straight. Place the mask over the child's nose and mouth, making a tight seal. Have your child breathe out. Press the top of the MDI so it sprays into the chamber. Only press 1 time. After spraying the MDI into the valved holding chamber, breathe in and out for 10 seconds. You can watch the valve move in and out to make sure your child is breathing in the medicine. If possible, have your child hold his or her breath for 10 seconds, then breathe out normally. Wait 1 minute and repeat as prescribed for a minimum of 2 puffs. If the medicine is an inhaled steroid, have your child rinse his or her mouth and brush his or her teeth after each treatment. Make sure you rinse and spit and don't swallow. Clean the spacer and mask once a week. Remove the mask and take apart the spacer before cleaning. Wash the spacer and mask in hot soapy water. Do not place in the dishwasher. Remove them and rinse with clean water. Allow it to air dry on a clean paper towel. Each week, clean the small hole inside the MDI with a wet Q-tip. This will prevent the hole from getting clogged with medicine. Before using the MDI for the first time, read the package insert to see how many doses there are in the MDI. Many new MDIs track doses with counters. If your MDI does not have a counter, mark each dose on the plastic cover. When the counter reads 0, get a new MDI of medicine from the pharmacy. The MDI will still spray, but no medicine will be delivered.